Hello, my name is Aarya Ramprasad, and I will be presenting on behalf of my team for our poster, Exploring Patellofemoral Syndrome in Young Female Athletes, a common yet underdiagnosed condition. So, patellofemoral syndrome is commonly seen in runners and adolescents, and it is characterized by anterior knee pain due to sensitized nerves around strained soft tissue and bone around the kneecap. It frequently occurs due to overuse and weaker muscles that are surrounding the kneecap, which leads to increasing pain with use. Its incidence within the United States is 3 to 6%, with women being more commonly affected. There's a 2.23 times higher chance of diagnosis for women in comparison to men. The prevalence within the general population of women is 12 to 13%, with the number increasing to 16.7 to 29.3% in women who participate in sports. With runners, there are a lot of injuries that end up going misdiagnosed due to the similarity of presentation that can possibly lead to misdiagnosis and a skewed number of, quote, true diagnoses in the population. So in our study, we aim to uncover the prevalence of patellofemoral syndrome in the running population based on a person's recollection of their symptoms, as well as understanding the reasoning behind possible underdiagnoses by medical providers. And so for our methodology, our study had two parts. The first part was made of 400 surveys being sent out nationwide that were split equally between men and women. 200 of the surveys were sent to college students on a cross-country or track team, and they have to have been on the team for at least 1 year. The other 200 surveys were sent out to college students who were not involved in any athletic activities. Each participant received the following question, quote, during the past year, have you experienced the following symptoms due to an injury? 1. Pain in or around the front of the knee. 2. Pain on the front of the knee after sitting for a long time with your knees bent. 3. Pain related to a change in activity level or intensity. 4. Popping or crackling sounds in your knee when climbing stairs. All questions with the intention of describing symptoms of patellofemoral syndrome. In the second part of our study, we sent out 100 surveys to orthopedic surgeons asking their thoughts on patellofemoral syndrome as a diagnosis and why they believed it could go missed at some times. These results were analyzed by our team. And so, for the 400 surveys that we sent out, we received 247 surveys back. 79 of these surveys were from college students who did not participate in athletic activity, while the remaining 168 were from college athletes. Of the 79 non-athletic students, 31 were men and 48 were women. 7 of these 79 students stated that they had experienced the symptoms stated in the question, broken down into 3 men and 4 women. Of the 168 athletic students, we had a response rate of 98 men and 70 women. 49 of these 168 athletes stated that they had experienced the symptoms that we explained in the question, made of 21 men and 22 women. And 62 out of the 100 surveys sent to orthopedic surgeons were received, and these results will be discussed a little bit more in the following section. And so our results showed that it is more common for athletic females to have experienced symptoms of patellofemoral syndrome. For our population, that was 31.4% of the total population, which is higher than the general population average that we discussed in the introduction. This may be possible due to a smaller sample size that we used in this study. Surveys from our experts did express that after even years of practice, there can still be some hesitation for commonly presenting diagnoses. Some similar differentials that they mentioned were Osgood-Schlatters disease, plica, bursitis, saphenous neuritis, and patellar tendinopathy. Providers also noted that treatment for many of these sports injuries were very similar to begin with, including the acronym RICE, or Rest, Icing, Compression, Elevating, and Continued Monitoring. This ended up being an important point as it showed that there was less focus on the actual diagnosis and more so on the treatment plan. So physical exam, history, and possible imaging are important if pain continues to happen after the conservative treatment is initiated, which is what most physicians relied on for their final diagnosis and judgment. Many physicians also stated that they saw patellofemoral syndrome as a quote blanket term, as it encompassed many issues that included anterior knee pain. Other conditions that were not in this category were things that involved the extensor mechanism, intrinsic pathologies of the patella, and instability. And so we hope that focused efforts on ruling out other similar causes and educating on finer details can help rule in or out differentials to help prevent mistakes occurring in clinics where misdiagnoses with improper treatment could occur. Thank you so much for your time, and I'd be happy to take any questions.